I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village. I'm also the co-host on the show It's About You on WKYC Channel 3, where we lift up people who are everyday champions in our community. However, this segment is about you. Yes, it's about your health. And I thought it was great as a leader in the community to partner with a great hospital like University Hospitals and talk about topics that will help you in your area of health during the pandemic. So today I'll be speaking with Nicole Jirousek. She is a clinical educator and she's also over the nursing staff training and development at University Hospitals Bedford Medical Center. Thanks for being on this segment, Nicole.
Thanks for having me.
So what are we going to talk about today?
Today we're going to talk a little bit about stroke and what you can do to take care of yourself and help prevent, hopefully, stroke in your life.
A very sensitive and serious topic. And so I wanted to start off by asking you, what are some of the risk factors of stroke?
There's a lot of risk factors. Some of them you can change in your life, and some of them you just have to kind of watch and monitor. So things like high blood pressure, diabetes, smoking, diet, activity and exercise, family history. If you're sedentary or if you like to move a lot, that can have an effect on it. High alcohol intake. Sickle cell anemia can actually have an effect on whether you have a risk for stroke, as well as hormonal changes in women and stuff. So,
wow, so there's a lot of risk factors involved.
yes.
But what are some of the warning signs that you should look for?
Some of the warning signs, we try and go with be fast. So fast, the F would be your facial droop. So you can look for, you'll see a facial droop. There'll be an uneven smile. If you have somebody, they can't quite talk right, loss of balance, confusion, slurred speech can be a sign of it. Difficulty understanding either way, whether they can't understand you or you can't understand them. Severe headache can be a sign, or in some cases, the worst headache of your entire life. That's a different type of stroke. And overall generalized weakness can be a sign. So, and these are all things that would come on suddenly. So,
and I love that acronym you use, FAST. So why do we have to, really work fast when we get these type of symptoms?
Well, like I tell people, time is brain. So the quicker we move, we actually have a chance to treat and save some of that muscle. So if we can go in, and if this is a stroke that can be possibly treated, there are medications that can help stop damage to the brain, because that can be very, very, very damaging to somebody's life. And a lot of life changes have to be made if you don't act fast. It can lead to long-term and lifelong disability if you don't act fast. So I like using the be fast or act fast because it helps us remember things we look for, as well as a reminder to move fast and treat these so you can save your brain.
Gotcha. So if these things happen, get some medical attention. I get it.
Yes.
Also, who's at risk for stroke? Are there a certain type of person? I know you talked about the risk factors, but who should really say, hey, this is something I need to look out for?
Yeah. And unfortunately, it kind of targets a lot of people, but some of the bigger groups is it can happen to anybody at any time. But after the age of 55, it increases significantly every 10 years. But like I said, it can happen at any time. Women who are on hormonal therapy, so birth control or therapy for menopause symptoms, they have an increased risk as well for stroke because it's messing with their hormones. Race can be a factor. So Asian Pacific Islanders, African Americans, Hispanic people of descent, they can have more. And like I said, that leads to kind of the sickle cell anemia, since that is a risk factor. So that's something to watch out for. And a lot of times, certain people in different cultures are more predisposed to high blood pressure or diabetes. So these are things we're already watching for, but they also lead up to stroke from this. Men have more of an increase in stroke at a younger age, but actually women have a higher incidence of dying or long-term disability from stroke because it happens later on in age. So it's much more significant a lot. So
So how do we reduce this? What can we do? I know you talked about diet a little bit, but what are some things that our viewers right now that are watching can say, I can do these things to eliminate, or try to lower my incidence of having a stroke?
yes, like I said before, there's some modifiable and some non-modifiable things.
Hmm.
The ones we can modify, I say work on them little by little because you can't, Rome wasn't built in one day. So anybody who tries to change their whole life, that's very difficult to do,
Right.
and have a support system. But we want to, if you have diabetes, that's not viable. But what is how you manage it. So if
Gotcha.
you're watching your sugars, you're taking your medications that the doctors prescribed, um, because if it's fluctuating and going all over, you have a higher incidence of stroke and
Mhm.
stuff like that. Like we said,
Mhm.
the healthy diet. So you want to really watch your sodium. There's a
Okay.
lot of things that have hidden sodium in them that you
Yes.
wouldn't realize it.
Mhm.
So a lot of the sports drinks that have like electrolytes, they have very, very high sodium content.
Mhm.
You wouldn't think Gatorade does, but it actually does. Something like a Mr. Hero Roman burger, that's a
Oh,
6-inch sub, that's
yeah.
delicious, but that's the entire amount of sodium you're supposed to have in one day in one of
Oh,
those. So that's it's but there are ways to work around it. I worked in a cardiac ICU before and we would do meal plans for people if that was, their favorite food. And you can kind of work with a dietitian or your doctor to make your meals around that stuff so you don't have to give up everything you love because some people they have their favorites.
right.
More fruits and vegetables are good for you, grains and moderate amounts of meats. So
Mhm.
like your red meats, you want to limit that throughout the week. Even fish that's good for you, you want to limit that a little bit more. Blood pressure is a big one. That's actually one of
Mhm.
the number one causes for stroke.
Mhm.
So you want to no, number one, know if you have high blood pressure. So they say you should get that checked at least once a year.
Okay.
A lot of people are predisposed to having that in their family situation. So no matter how healthy you live, sometimes you're just going to have high blood pressure. So they say you should, number one, know if you have it. And number two, make sure you manage it because it's
Mhm.
very dangerous to actually have high blood pressure either constantly or blood pressure going up and down. That's a number
Mhm.
one risk of stroke.
Mhm.
Exercise, and that's in moderation. It doesn't have to be heavy duty, sweating, constant exercise, but getting up and moving. You're walking more, you're not sitting all the time.
Mhm.
Park a little farther away from the store and get those extra steps in. All of those things can help you out.
Okay.
Smoking is another huge one. Smoking actually doubles your risk for a stroke because
Wow.
it tightens up those vessels.
Mm.
So if you do smoke, try and find resources to help you quit smoking. It's
Mhm.
not an easy thing, but find support. Your doctors, a lot of the times, can help you with resources for that, whether they're support groups, that sometimes that helps people the best. Having
Mhm.
somebody to just talk to, to get rid of that habit. And then last is limiting alcohol.
Okay.
A glass a day or here or there is one thing, but drinking in excess that can actually lead to an increase in your risk for stroke.
Wow. Well,
So.
that's very informative. I was wondering, during COVID-19, if there is, is there anything that we should do different if you think you're having a stroke during COVID-19?
Absolutely not. You should call
Mhm.
911 as fast as you
Mhm.
can. And that's what you
Mhm.
should do in any case of a stroke. Call 911 because they can actually start treating you before you get to the hospital. And
Mhm.
the hospital's ready for you when you get there then. So it actually has an increase for your outcome to be positive if you use an ambulance and call 911. You're already en route and getting treatments to save your life. And
Okay.
especially in COVID-19, we want you to come in because this, like I said, this could be disabling for the rest of your life. So call 911, come to the hospital, and we'll figure out if it's a stroke or not. If it's not, then we can find out what's going on. And if it is, you can save your brain. And
Great.
also, people who have COVID-19, you could have a little bit more of a risk to develop clots. So,
Oh,
people
wow.
with a history of COVID-19, treat it the same way. If you start to have any of these symptoms, please just call 911. Like I said, our goal is to save your brain and save your lifestyle so we can all continue to live and be, participating in society in our lives.
I
So.
like it. I like it. Well, Nicole, thank you so much. Before I go, tell us about that acronym FAST one more time. Those are the signs.
Yes, well, it is, and like I said, I like it because it's very, very good for multiple reasons. You want to know it, number one, because we kind of go the fast right now, which is like
Mhm,
new,
mhm,
because balance is an issue as well. So the
mhm,
B is your balance,
mhm,
E is eyes,
mhm,
F is your face. So you want to
mhm.
be able to see that somebody's smiling even. A lot of
Okay.
times people, one side of their mouth, they won't be smiling and you'll notice that. And that's
Mhm,
kind of a very easy giveaway.
mhm,
Arm. So if they have weakness, you're not always going to ask somebody to raise up their arms. But a lot of times if they have weakness in one arm or both, that's sudden. They won't be able to lift or hold their arm up. That's a sign.
okay.
Speech, which could mean either something as simple as it's slurred and hard to understand, or
Gotcha.
sometimes people are saying the wrong words. So
Mhm,
you'll ask somebody something and they'll tell you something completely different and then look confused because they don't mean to be saying that. Or sometimes
mhm,
they lose the ability to speak. So like significant changes in somebody's speech pattern,
mhm.
or if you're saying to something to them and they don't understand, that falls under speech. And last is time, which is very, very, very important. You want to act very quickly. So that's why I said call 911, get to the hospital so we can check it out, because the goal is that in a lot of these situations, you can get medications that can help save some of that brain tissue and reverse some of these things so they aren't permanent and lifelong for you.
Gotcha. We got to
So
save the
be fast.
brain. Gotcha. Well,
Yes,
thank
we
you
do. We do.
so much. Thank you so much,
Oh, thank
Nicole,
you.
for expanding our knowledge about stroke and about how people can get the help that they need very quickly. And also to all of our viewers, thank you so much for tuning in. Make sure you also go to my website, LarryMaconJr.com, where I have other access to other interviews of other doctors and nurses and those that are in the healthcare industry. And also special thank you to University Hospitals for continuing to make sure that everyone is living a healthy life. Remember, good health is good wealth. Thanks again, Nicole Jirousek, for helping us learn a little bit more about strokes.
Thank you so much for having me. It was my pleasure.